In April 2021, the National Institute for Health and Care Excellence published the updated guidelines for managing chronic primary pain. These guidelines recommended a single course of acupuncture, which has caused some controversy amongst professionals and confusion for people living with pain. In this video, I'll provide some clarity on whether acupuncture is helpful or not for managing chronic pain, so that you can have more confidence when discussing this as an option with your patients, or to reduce the confusion surrounding acupuncture if you are living with pain yourself. Hey friends, welcome back to the channel. If you're new here, my name's Mahin and I'm a physiotherapist specialising in pain management based in the UK. On this channel, we explore lifestyle strategies and tools to help manage pain and create healthier and happier lives. Today I'll be answering the question, does acupuncture work for chronic pain? So let's get into it. Acupuncture is a treatment derived from ancient Chinese medicine where fine needles are inserted at certain sites in the body for a therapeutic response. Acupuncture is seen as complementary or alternative medicine and is commonly used for chronic widespread pain, chronic primary headache or migraines, or orofacial pain. But acupuncture is being used less and less in the NHS these days, and it's found more in private practice. And this is because of some of the difficulties around the cost effectiveness of acupuncture in NHS services, and also the effectiveness of acupuncture in the long term, which we're going to talk about today. An initial acupuncture session usually lasts around 20 minutes to 1 hour and involves an assessment of your general health, medical history and a physical examination, followed by the insertion of the acupuncture needles. Courses of acupuncture treatment often vary, but they usually include several separate treatment sessions. From what I've heard, a course of 6 sessions is pretty much standard. The guidelines by the National Institute for Health and Care Excellence, otherwise known as NICE, made the recommendation for acupuncture because it found that 27 studies showed that it improved pain and quality of life in the short term of up to 3 months. This is because it involves stimulating sensory nerves under the skin and in the muscles, which results in the body producing natural substances such as pain-relieving endorphins. I want to be absolutely clear here that acupuncture does not, and is not claiming to, fix any perceived damage or alter structure in any way. The way that acupuncture provides a pain relief is by stimulating nerve endings under the skin and in the muscle, such as nociceptors, which detect a change in mechanical pressure and produce the release of chemicals such as endorphins, which are our natural pain relieving chemicals. And it is found that a course of acupuncture, rather than just a single session, provides more of a longer term effect with this pain relief. And overall, there's actually quite a large body of evidence to show that acupuncture is effective in the short term of up to 3 months. So taking these factors into account, NICE made the recommendations for acupuncture based on a few caveats to make it more cost effective. And these caveats are so that it's only delivered in the community with a maximum of 5 treatment hours and from a healthcare professional of band 7 pay level or lower. So the pain service that I currently work in doesn't have anyone operating at a band 7 level or lower, so we're unable to offer this treatment fitting in with the NICE guidelines because it just wouldn't be cost effective. And actually this doesn't disappoint me because I feel that the time that I have with patients could be better utilized than using it for acupuncture. And I'm going to talk a little bit more about that at the end of this video. So there's actually not enough evidence to determine the longer term benefits of acupuncture for chronic pain that lasts longer than 3 months. And that's just because we don't know whether those benefits are sustained or how long those benefits are sustained for. At the moment, there is no evidence to suggest that the effects of acupuncture last longer than a 3-month period. And this is very similar to the research and the evidence that we have around opioids for the use of chronic pain as well. And this really makes me wonder why the recommendation was made for acupuncture when we don't know whether the effects last longer than 3 months or not. We've taken opioids off the recommended list of medication for chronic pain for the same reason, in the sense that it doesn't have any effectiveness past 3 months, yet acupuncture was left on the list of recommendations. And I appreciate that acupuncture doesn't come with the same side effects and long-term risks as opioids does, but it's the same in the sense that there's no evidence to support its effectiveness past 3 months. And this can be really confusing, and it kind of opposes what we know about pain and how pain works. So suggesting that acupuncture works for chronic pain actually implies that a lot of the pain is down to nociception alone, and we know that this just isn't the case in persistent pain. It's really important to remember here that nociception is neither sufficient or necessary for pain. If you're unsure about the terminology around nociception, I will leave a link to one of my previous videos which explains explains what this means. From my previous videos, you'll know that pain is influenced by a wide range of factors, including psychological factors, social factors, and lifestyle factors as well. And in persistent pain, it's extremely likely that there's multiple factors that are contributing to the overall pain experience. Therefore, a treatment method that focuses on a very specific short-term biological response is very unlikely to have a long-term effect. There could be an argument that acupuncture is helpful alongside other approaches such as exercise and psychological therapy. However, if this effect is only short-lived, then is it really helpful when you have a long-term pain condition? There's also no evidence to suggest that repeated courses of acupuncture are helpful. So this would mean only one course of acupuncture within potentially years of living with pain, which would actually make it quite an insignificant treatment option in the grand scheme of your long-term management. There is so much variation in the availability and use of acupuncture for chronic primary pain, and we've actually seen a reduction in this treatment option being used. And this is due to the number of people who present with chronic primary pain, and also the fact that acupuncture is an individual patient intervention. So it can be quite staff intensive as well. And the question really is then, can our time be better used? And I personally think it can be. I think if I've got a patient in front of me, I would much rather use the time to discuss lifestyle ways that they can manage their pain that's going to be more helpful in the long term than use the time doing acupuncture, which might help in the short term. And again, there's no evidence to support its use past the 3-month mark. I want to be absolutely clear here that I'm not saying that acupuncture is harmful and that it shouldn't be used, but it's just really important to make sure that if you are the person receiving acupuncture, you know exactly what it's doing and that actually there isn't any long-term benefits of it. And it's absolutely fine if you're only going for the short-term benefits and you know that you're only going to get a short-term benefit and you're using it as part of your wider pain management plan. That's absolutely fine. You know, that's your choice. But it's just knowing that it is only a short-term relief. And some of the difficulties that I see with patients is that because acupuncture works for a short time, private practitioners, they recommend having repeated courses, and they sometimes even say twice a week that's needed. So people are going back quite often, and the short-term effects are being carried through until the next session. So it works in that short term. But what it means is that that person is having to keep going back to that person to receive the acupuncture. Now that can be quite costly in terms of time, but also quite costly in terms of money as well, because these services are not cheap privately. And the thing is, when we're spending more time, more energy, more money on trying to control the pain, we have less time and energy to spend on our enjoyable and meaningful activities. You'll also know, if you've watched videos on this channel before, that the secret to managing pain in the long term is engaging with things that are important to you. Because unfortunately, there's not one single fix or cure for persistent pain, but actually the long-term management comes from being able to engage with the things you want to engage with. But if we're using all of our time and energy on trying to control the pain, we have none left for being able to participate in those activities. And remember, there's still no hard evidence to support the long-term effects of acupuncture for chronic pain. So if you're living with long-term pain, or you're helping anyone with long-term pain, can we really say that acupuncture works for chronic pain? In my opinion, the answer to that essential question is no. To find out what will work for you in the long term, check out my Living with Pain playlist if you are experiencing chronic pain. Or if you're a professional working with people experiencing persistent pain and you want to find out better long-term strategies for your patients, then head over to my Do Your Patients Have Pain playlist next. Thanks for watching, take care, and I'll see you next week.